Institute of College of Occupational Therapy and Allied Health Sciences, where I learned a lot. It's very good. Before coming to Ireland, it's a great learning from international students, and this is one of the biggest library in South India. It's a great place to learn, and I worked there for nearly 2 years. Then I moved to Ireland. This is CORK Foundation. This CORK Foundation is for children with the intellectual difficulty. It's a special school, and I worked there for 11 months, but I got loads of experience from their seating, positioning, wheelchair assessments and interventions, lot individualized specialized program for children. And here in the middle, I'm staying here for last of 13 to 14 years in neonatal unit, where I'm learning, still learning lots of things, and every month or every week new challenges coming to me, and it's great to learn with other team members. Before I go into presentation, I would like you to have an experience of how the neonatal unit looks like. It's not my unit, but it's a similar kind of unit. I found it in this video. Let us watch this one.
I'm Callista Damon, and this is my husband Ryan. They were doing the ultrasound and they said, "Oh, there's your baby. Oh, and there's your other baby," at 24 weeks and 6 days. And I just started feeling really sick. And when I had my ultrasound, they told me, "You're having these girls today." Madison was 1 pound 3 ounces and Camden was 1 pound 7 ounces. Overnight, Madison had had a really bad night. We found out she had a stage 4 brain bleed.
In Maddie's circumstances, unfortunately, her bleeding was extremely severe, and it was just part of a very complicated picture.
And we could tell she was suffering.
She fought through every obstacle. You could see that she was deciding it was time.
She ended up passing on May 29th. It was very, very peaceful. We got 9 days with her, which is more than a lot of parents in our situation. Our girls are identical twins. That means we never have to really wonder what Madison was going to look like because we have Cammie.
Cammie suffered from an infection of the bowel called necrotizing enterocolitis,
which basically means that her intestines really weren't handling the breast milk that she was being given.
We removed a significant portion of the middle part of her small intestine.
Dr. Kenny's actually done all 3 of Cammie's surgeries. He stops by all the time to come and see her and see how she's doing, but always takes the time out to ask how we're doing too.
We all really depend on each other, and I say that as one member of a large team of people taking care of the patient.
The first study we're asked to be in was basically a study where they're looking at what causes prematurity.
Collecting the information that we collect and looking for things that cause a baby to have a good outcome or a bad outcome, we can use that to develop treatments.
We've made such tremendous advancements in the last 40 to 50 years, and now our research efforts are focused on really improving their quality of life, really pushing the boundaries of how we can achieve the best outcomes.
There are so many people that were here before us that did these research studies, and that's why her care went the way it went.
We're here a lot, so we actually get to build some really good relationships. Okay, you gotta sit up. Our primary nurses have kind of become like a second family to us.
Well, it starts out when the baby's very tiny and just getting them to participate in changing a diaper, which can be a little scary when your baby weighs 2 pounds and there's a lot of cords and wires and things attached.
They just take really fantastic care of her.
You're fine. You're fine.
A lot of the nursing staff teaching us how to do things like how to care for her incision, how to care for around her G-tube site, as well as, you know, OT, PT, they teach us all these things that we should be doing with her.
She was always making progress, but the point where you could see her do more and more is when she came to an age that she was closer to term, she was more interactive, she was more tolerant to activity, even if it was just lifting her up a little bit or allowing her to do a little bit more motor challenges than she had before.
Valerie is absolutely fantastic. 9 pounds to
Whoa, bedtime! Yeah.
Valerie came by and was cleaning Cammy's bed area, and she started talking to me
How's mommy feeling?
about her, and just that she had been over here for quite a while and seen her, and you know, she was growing so much.
Meeting the families, you know, they already going through a lot.
And I was really touched by that.
But that's what I try to do, provide the highest quality of care and service in the baby's room. And like I always tell the nurses, they take care of the babies and I'll take care of the rooms for them.
You always use "do" as the code word because you can't, you know, jinx anything. So we're going home today. Thanks, guys. Thank you.
So you watched in this video few terms you may not have understood. Necrotizing enterocolitis. Mom was mentioning that what it is when the premature baby gets milk. Sometimes it's their digestive system is not developed yet, so it acts as an antibody and gets necrosed, so they have to remove that part of intestine, that is necrotizing enterocolitis. And mom had twins. One twin passed away in the womb. And did you notice the ring on the baby's foot? That is mom's ring, and it's almost fitting the baby's leg, that small. We get all the babies like less than 500 grams. I have seen one baby with 430 grams, that small. So these are daily occurrence in our unit. Our unit, we get lots of premature babies under 37 weeks, as WHO says. Any baby born under 37 weeks, they are called premature babies. But for occupational therapy and physiotherapy, we get referral for babies born under 32 weeks. If the baby born under 32 weeks, we will see those babies. So above 32 weeks, they do very well. 99.9% they do well developmentally. These are the scenes in the unit, and everyone, our team members are treated very well. As you have seen, environmental services, they are cleaning staff. They are very important at this moment, isn't it, during COVID period. So everyone is crucial in our unit. We have biomedical engineers, consultants, nurses, allied health professionals, occupational therapists, physiotherapists, social worker, pharmacist, dietitian, everyone. And in this team, baby and parents are team leaders. We are part of the team to get the baby go home healthy and well and recover from the unit. I'm not going to explain lots of prematurity, but I will look into other high-risk babies, or what I'm going to present today. I have, out of 6 babies, I have seen 5 babies first time, and I haven't come across again those 5 babies. That kind of difficulty they had. So this scenario, baby got admitted after 2 months, and their newborn reflexes are absent, like palmar grasp, Babinski sign, and Moro reflex. Everything is absent. Muscle power in all 4 limbs are 0. That means no flicker. You don't have any muscle power. And MRI scan, CT scan, blood tests were normal, and sorry, 3 months old baby, and EEG was normal. If you want, you can, in the chat button, you can write your answer. You can guess. It's not right or wrong. You can write down, type down your answer, and we'll see after a few moments. So what could be the diagnosis? It looks like lower motor neuron lesion. That means like only muscle junction and beyond muscles, not from the spinal cord or upper motor neuron lesion. It looks like lower motor neuron lesion, isn't it? It's called infant botulism. It's a rare neuroparalytic disease that can occur in babies under 1 year of age. And it occurs when infants swallow spores of particular bacterium. Where this is coming from, you'll be shocked and surprised to hear. This is Clostridium botulinum. Many of high society people gets Botox for their skin to get younger. So this botulinum is in honey. So this baby, these parents might have given honey, so it might have affected their myoneural junction, and botulinum causes the paralysis of the muscles. So this baby got paralyzed totally because of honey. So 2 to 7% of honey samples contain Clostridium botulinum. So never ever give honey for babies under 1. It might get affected. They might get affected because of this botulinum. Shouldn't give honey to baby to calm down or soothe. So we should avoid honey. This is how the baby looked. Poor head control, because 3-month-old baby should have head control and moving hands and feet, but this baby didn't have anything. 0 muscle power, and was ventilated, and ventilated for long many weeks. Finally, the baby recovered after getting this drug called anti-botulinum toxin, that is called Baby Big. It's very expensive. because in Ireland we never had this condition before, so it has to be imported from US. It's $45,300. I was converting to Indian money. It was coming around 35 lakhs. It's very expensive. Finally, I saw that baby after discharge. The baby got very well and extubated from ventilator, recovered very well, and gone home with full reached the previous development. And I saw her at the age of 1, and she was doing very well, and no difference. And pediatricians and every multidisciplinary team, we discharged her and doing well. She's now 8. The next baby, another interesting baby, we in our unit we have nearly more than 30 years experience. Experienced nurses are there. They haven't seen this kind of clinical features in baby. So this baby was born 39 weeks of gestation and 39 weeks and 5 days of gestation, nearly 40 weeks. 40 weeks is the full term, and birth weight was 3.43 kilograms, and baby was very not responsive, so they resuscitated. APCA scores, so they count out of 10: color, appearance, grimace, respiratory rate, heart rate, all together. It counts up to 10. So at 1 minute, this baby had only 3 out of 10, and 5 minutes 4, and 10 minutes 5. That's very serious. So if they are below 5 at 5 minutes, so the baby will needs therapeutic cooling and EEG monitoring installed. What could be the diagnosis? It's job for your fingers. Can you please type your answer? And this baby also had left upper limb skin disformation, radial aspect, and poor perfusion and cyanosis of distal arm, and immediately after delivery. So the baby was unresponsive. APCA score were very low and not breathing, very floppy, and left hand was very discolored and black, nearly black. So the diagnosis was encephalopathy. Encephalo means brain, pathy is pathology. So brain in the brain pathology with seizures, and along with discoloration of hand. So very complicated. I haven't seen this kind of features in any babies. It's very unusual. So this baby had a neonatal stroke. Yes, babies do get stroke. Usually we heard about stroke in adults, but babies do get stroke. So this baby had left hemisphere, left cerebral stroke, and left brachial artery occlusion and cyanose. So the brachial artery, there was obstruction in the middle. In the Doppler scan, they found occlusion in here in the middle before cubital fossa. And this is how the hand looked for that baby. Very black. And surgeons, pediatrician discussed with parents whether to amputate the upper limb from above the wrist, or the baby was in high antibiotics to avoid any infections. They kept giving lots of antibiotics, and parents were discussed and updated every day regarding the situation. It became darker and darker of this hand, and they couldn't decide whether to amputate or not. They kept giving antibiotic. And left hand is kind of gangrene, like necrosed, and right upper limb and lower limb got stroke, increased muscle tone. Hard, very hard for the parents. And they waited for many days, and somehow the artery got unblocked and given blood supply to the hand, but still the injury happened. It affected his hand. And this is the MRI scan. You can see the extensive hemorrhage on the left left cerebrum. And this is how it looked after a few weeks. Sorry for the picture, cross picture. So left brachial artery thrombus and left hemisphere infarct secondary to thrombus. So in the womb itself, in mom's womb itself, it might have happened, the thrombus might have affected the cerebral artery and could be flowed to the brachial artery, and it affected the left upper limb as well at the same time. And after 2 years, they didn't do the amputation, and the hand became, the fingers became smaller. And he's 3 years old now, and he is walking and good speech. Children brain is great for plasticity, and the baby brain is very, very capable of learning and adapt whatever the lost functions, the other parts of brain take over. So he's now walking and fairly okay upper limb, right upper limb functions. He's walking, talking, and playing well, and he's getting pressure garment for his scars, but some kind of grasp he has between the fingers and the palm, but it's not very functional. But he can use this left hand for bilateral coordination. He's doing well, and he's amazing child, and his first 1,000 days was very, very tough, and he's doing well now. I'll go on to next baby. This infant with fatigue, difficulty in sucking on pacifier, inactivity, and decreased tone of the muscles. Again, the job for your fingers. Guess your diagnosis. It's okay if it's wrong. Congenital myasthenia gravis. You might have heard myasthenia gravis in adults, but in babies also do happen. So the weakness of eye muscles, drooping of one or both eyelids, it's called ptosis, and blurred vision, change in facial expression, difficulty swallowing, shortness of breath. So this baby had severe breathing difficulty and had to get a ventilator support, and very, very floppy, and he was not moving his limbs. And he was born in UK, and he was treated there, and he's an Irish baby, and he was transferred here. They were treating this baby for myasthenia gravis for maybe 3-4 months. Then the here pediatricians thought it's not improving, and they went on investigate further, and they found out he doesn't have myasthenia gravis. He had congenital myopathy, not myasthenia gravis, because congenital myopathy also has similar features, so they couldn't differentiate the diagnosis. It's called differential diagnosis. So then again, lots of muscle biopsy and genetic testing done, and confirmed it's congenital myopathy. All the team members are working on his functional skills, and he was improving, but he needed a tracheostomy, which connects to the ventilator if he needs. He's into he couldn't walk, and he's in wheelchair now. He's 10-year-old. Let's see how he is doing. So all the team members are working for his home and the school environment. He's 10-year-old and going to school. And we'll watch this video.
Ian doesn't know what he's waiting for. We just dragged him out the front. Happy birthday to you. Happy birthday, dear Ian. Happy birthday to you. Hooray! Was that amazing?
During Corona time in April, he had 10th birthday. He was very alone. Like, he's very, very, his cognitive skills are very good, and he communicates with iPad, and he has a speaking valve on his throat, and he has tracheostomy, and when he sleeps, he will be connected to ventilator, home ventilator. He's staying at home. Mom is full-time carer. And yeah, his 10th birthday, he was very sad, and it was a surprise. Many police department and ambulance came to wish him on his birthday in Cork in April. So he's doing well, but in different way. Another baby, actually this diagnosis, I have seen many babies, not one. So these two happen few times. So the baby with a hole in the diaphragm allows abdominal organs go into their thorax or chest cavity, and it presses the heart and lung. Because of that, it's affecting. Can you please type, can you guess what diagnosis this one? Are you done? Yeah. So this is called congenital diaphragmatic hernia. So when in a normal baby, the diaphragm is separating our thorax and abdomen. So it will prevent all the organs to keep the organs in the abdominal cavity, and the chest cavity will have lungs and exclusively for lungs and heart. Whereas in congenital diaphragmatic hernia, when there is a hole, the abdominal organs can go into the chest cavity and press the heart and lung. And sometimes the heart might go to right side of the chest. So it affects, seriously affects children. Sometimes they need ECMO, extracorporeal membranous oxygenation. So what involves is they will have heart and lung outside. It's a mechanical heart and lung, and blood goes to the machine and purifies and bring back to their body. So that is ECMO. And CPAP, continuous positive airway pressure. So they need, because they can't breathe freely, so they need assistance. And if the baby has long-term breathing difficulty and long-term ventilator need, they will do tracheostomy. They open the trachea and put a permanent, not permanent, for temporary, for a few years. They put a tube to connect with the ventilator. It has easy mobility if the patient wants to go home. We'll look at this video.
We found out before Liam was born that he had a congenital diaphragmatic hernia.
It's a long phrase that just means there's a hole in the muscle in between your abdomen and your chest. Patching up holes is not that hard. The hard part about congenital diaphragmatic hernia, though, is all of the harm that is done until we can fix it. Because when there's a hole between your abdomen and your chest, the intestines go up into the chest during critical stages of lung development, heart development. It can make babies really, really sick.
We were just devastated. We never heard of that. We never knew anyone with that condition before.
They're honest and up front with us the entire time. They walked us through everything. They sat down with us. They assigned us a person that showed us tours and brought us to meetings.
My role typically with the family is being a touch point throughout the pregnancy, being there and available to answer questions, trying to coordinate appointments on the same days as much as possible.
Meeting with the mother, there will be evaluations, the ultrasounds, the MRI. That allows us to kind of know the baby by the moment the baby is born.
There are a lot of babies with diaphragmatic hernias that don't survive, but there are a lot that have tough courses. But what you want to know is you're going to have a team fighting for your baby.
Every single doctor that we talked to said, you either go on my chart or here's my card, here's my email. I will get back to you within 24 hours.
They pretty much held him up and let us both see him right as he was born. And then they had to take him to get his IVs and everything set and get him stabilized.
These babies, they'll put little headphones on to kind of block out some of the noise. Babies with congenital diaphragmatic hernia, they don't really like to be touched a lot.
It was so hard to just see him laying there, and he'd get upset every now and then and not be able to do anything?
The first few days are really best letting a baby relax, letting them get through all the transition of being outside in the world. And only when things are settled down and it's safe to proceed with surgery do we go ahead and plan surgery.
I trusted Dr. Rice. I trust the team. They had been honest up front and open with us from the beginning. But still, at that point, you're so nervous.
Depending on what the type of hole is, we will either close it primarily, meaning we don't need any extra material. We just need to bring the edges together. Or we need to reconstruct the diaphragm with a patch of some type. And in the process of doing that, we will turn off all the abdominal contents back into the abdomen so that the lungs get a chance to expand, get a chance to recover, and can grow in a normal fashion.
Some babies are able to go home in a short period of time. Some babies require to be in the hospital for a few months.
It's amazing. You know, having a diagnosis where it's a possibility that he could never come home to having him home is amazing.
I don't know, it's amazing to have this little person. I can't wait to see him grow up and what he'll become.
Most babies with diaphragmatic hernia that get through the newborn period have relatively normal lives. They run around with other kids. They play sports with other kids. They eat like other children. A diaphragmatic hernia is a tough diagnosis. There's always hope.
Recently, we had one baby in the unit and transferred to pediatric ward, and he was staying nearly 2 years after surgery and after tracheostomy, and he has he can't have food or drink milk by mouth, so they had a peg feeding. So they opened the tummy and connect a small tube and directly feed into the stomach. During ECMO, he had a small thrombus gone into his brain, and it affected his basal ganglia, and it affected his tone and balance. That's why he was staying more than nearly 2 years. Some babies, they don't need tracheostomy. Some babies do. So we'll watch another video of baby with tracheostomy.
It is a hard life dealing with a chronically ill child, and then you have a trach, which can be very scary. You're the doctor, the RT, the nurse. You're the one, if something happens, you have to be very well informed as to what to do to bring them back to life. That can be very stressful and a huge burden put on a family. Allie was born February 5th, 2012, and she was flown here to Children's. She was an undiagnosed right-sided diaphragmatic hernia, which means all her organs that are below her diaphragm were in her chest cavity. So she basically just has one functioning lung. She was on ECMO, head cooling. She had a really rough start. She was in the NICU for over a year. Allie had severe pulmonary hypertension, so we knew she probably wouldn't get off the ventilator anytime soon, that it was going to be long term. We decided to do the trach because when you're intubated, you're just basically laying there in bed. You can sit up, but there's always the risk of the tube coming out. We just wanted her to have the best quality life that she could, so we just felt like that was the best decision. We had been here 2 years, and we never thought we were going to get to take her home, so I asked the APN, can I please just take her home for a day, just so we could be together as a family. And they did something far better, and they took us to the zoo. And we got to be a family at the zoo for one day. And I know it took tons of work to get everybody together and to coordinate that, but it was the best day ever. They had tried to get Allie on the home vent numerous times. She didn't want to. So we went to visit on a Friday, and that Monday she got on the vent, and we went home 2 weeks later. And it was amazing. Since the day she got her trach, I did all her trach care, and they came and trained me on everything, trach changes, trach care, granulation tissue, suctioning. You also had to learn what all the alarms meant on the vent, how to change the circuit on the vent, how to bag, how to do CPR. You could be out in Walmart and she needs suction, and if she's on her vent, she could turn a certain way and her trach would come out, and you're in the middle of Walmart changing a trach. So it was a lot of work, but we just wanted her to be as normal as possible and give her all the experiences that we would do. So we took her everywhere we went. And the staff was amazing. People say they have their person. Well, we have our people. And there's a whole team of them who literally would drop anything to help us out. And that just means the world when you're in your darkest days and these people come by and see you, and it just makes you feel so much better that they care. And they care about Allie, and not only Allie, they care about you, and they want to make sure you're okay. And they just weren't here for Allie, they were here for my entire family.
Like this, many babies gone home and they go to school with a tracheostomy. In that situation, parent will have a care assistant and special need assistant in the school to help them with the suction. So they, in their buggy or wheelchair, not wheelchair, sorry, buggy, they will have ventilator, mobile ventilator, suction machine, and oxygen cylinder. So it's a heavy buggy with a baby. If a child is mobile, and they all those equipments will be carried by another person, special need assistant. So it will help if child needs suction, and they have to do in the class, and they will have a speaking valve, so they can speak when it's closed, and they can learn in normal school. And after a few years, maybe 5-6 years, they can think of closing the trachea and removing the tracheostomy tube. And another baby had warm up your fingers. 6 hours old baby with following features: weak muscles, fractures in humerus, femur, and some fractures in lumbar vertebrae. And baby had blue and purple sclera, problems in breathing, brittle teeth, and this baby looked like has triangular face, bowed legs, and curved spine. Please guess the diagnosis. Type your answer. We'll move on to next slide. It's called osteogenesis imperfecta. It's a genetic disorder that affects the bone. It causes to be very weak and break with little or no trauma. Even small handling will give them fractures. Can you imagine if the baby is being born in normal delivery, the delivery process itself gives them fractures in many bones. They are very, very having weak bones, and it has various types, type 1 to type 4. So type 1 is the like less severe form, and they can lead normal life. But during infant and childhood life, they can have fractures, and it can be healed. And they need lots of calcium supplement treatments. And and I have a video of osteogenesis imperfecta. and we'll watch this one.
I'm very glad that I didn't listen to the doctors that told me that he wouldn't live or walk or do anything. If I did listen to them, I wouldn't have a strong little boy doing everything they said he couldn't do.
Let's build a big hole.
Let's build a castle!
Yeah, let's build a castle.
Build a castle!
What he likes about superheroes, I think, is they stand for good, and they fight the bad guys, and they save people, and they're strong, and they have superpowers, and I think superpowers is really cool.
And I'm going to do this.
No, if I kick you.
Blocked it.
I think Caden loves superheroes so much because maybe partially he feels like he is one, because he's already overcome so much and he can still do the impossible.
Okay, why do you like Superman? What's so cool about him?
Because he's my best superhero.
Really?
Yep.
Do you like his outfit?
Yes.
Do you like that he
And
can?
I like the fly parts.
Because he can fly?
Yeah, because I love flying. And I like Batman and
Green Lantern.
and Green Lantern and Superman.
I first realized there were complications around the 20-week ultrasound. His bones were very, very short, his capacity was very small, and his head calcifications were very low. They told me that he had about 9 healing fractures. He had about 4 on his ribs, 3 on his long bones, and then the rest were kind of just scattered all around the body. The specialist recommended that we consider abortion. It was 95% chance of him not living. We decided to bet on that 5%. You know, we wanted to meet our baby boy regardless. So we just went ahead and bet on it.
I didn't know what to expect. And he started crying, and we instantly knew, you know, he was gonna be okay. I melted. It felt amazing.
When Caden was born, it was like a dream come true. The entire time being told that your son is not going to live and you have to plan for a funeral. And in the back of your mind, you're like, this has to be wrong. I mean, he's going to make it. I know he is. Caden knows when he breaks a bone. He knows when he's injured. He lives fearlessly, but he lives with caution as well. He's had multiple injuries that he's learned from, like falling off the couch or being careful when standing on certain things. He knows what's going on by now.
So, remember how about a month ago you sat on your leg?
Yeah.
Remember that? And it kind of broke it a little bit.
Yeah.
Can you tell me how that felt? Felt bad? Yeah, I remember when you sat on it, you started crying, huh? Now you're trapped in the sand prison. He's out!
When I have to see Caden in pain, it kills me. I put on a strong face. I tell him it's going to be okay. I fake it. I medicate him, and then I sing a song for him, or I just make him feel better because it's about him. You know, it's not about how I feel, but it really does kill me.
That might be a bear cave.
He's like a glass doll, is what I call him. He's just a glass doll that you have to be very careful with. He still continues to astound doctors, even when we go to the emergency room for an emergency fracture that needs to be splinted by a doctor, they still ask me questions. They still ask, what kind of treatment is he on? How many fractures has he had? Does he break all the time? It's so rare that even they ask me what's going on.
He continues to surprise doctors, and he's fighting.
Kannan has the biggest personality. He's imaginative, he's creative, he's so kind, and he has so much empathy for other people. And I think that's a really special thing about him.
Hey, you play word and still be friends, right?
I think what people can learn from Caden is to love life, because you see how happy he is. If he's happy, then why can't anybody else be happy?
You know, I think the future for Caden is very bright. I mean, he'd be great with anything he did, anything he wanted.
All these babies are amazing because they are born with these difficulties, and they learn to overcome this tough period. And I have seen 3 or 4 babies with osteogenesis imperfecta. Osteo means bone, genesis formation, imperfecta. So imperfectly formed bone, that is osteogenesis imperfecta. And in the unit, we have to work with the nursing staff about handling, because for changing nappy, we can't lift their leg to change nappy like other full-term normal baby. So we need to carefully handle the baby. And yes, they are made of glass. They are easily fragile, and their bones are easily breakable during infant period. And it's a lifelong condition, and they have to adapt and adjust to their condition, and they do well understanding their conditions. And the next, I deliberately left this baby at the end. This is very, very rare thing we have seen, and it's amazing, miracle. Are you ready for typing your diagnosis or guess? It's okay if it's wrong. A baby born with 2 head, 2 heart, 2 lungs, 4 hands, 1 abdomen, and 2 legs. Any guess? I'll wait for a little bit more longer so that you can type. It's okay. We can learn from mistakes. So it's okay to be wrong. Are you done now? Yes. Conjoined twins. It's an extreme rare phenomenon. Occurrence is estimated to range from 1 in 49,000 births to 1 in 189,000 births, with a somewhat higher incidence in Southwest Asia and Africa. Approximately half of are stillborn, that is, before birth they die in the womb, or die unborn. An additional 1/3 die within 24 hours. Most live births are female, with a ratio of 3:1. And how it's formed, how these babies are grown in the in the womb. There are 2 contradicting theories. One is through fission, and in which fertilized egg splits partially. The other one is fusion, like 2 two separate fertilized egg comes together and fuse together. We don't know which is right, but they do happen. And they share a common chorion and placenta amniotic sac, and these are conjoined twins, same as monozygotic non-conjoined twins share this similar things. Chorion, placenta, amniotic sac will be shared by monozygotic twins. And these are the babies. Their names are Hassan and Hussein. They born in London, and they are from Cork, and they transferred to Cork after being born. In our unit, they were in our unit for nearly 2 months, and they went home. And before going home, we had an interesting thing, because parents were not telling the world. They kept it secret, and they had a separate individual room in the unit, and many politicians came to visit him. And that time, external minister was visiting him, and he when I met him, he was saying, "I've been to India." Oh, okay. But I didn't know that time he was a minister. So he and his name is Michael Martin. He could be next Prime Minister of Ireland in few years' time. So after going home, these twins, they went to London for surgery, separation surgery done in London. And after that, it became public, and they became very famous.
It's a big fight for such little ones, but Hassan and Hussein Ben Hafaf are winning the battle for survival. The conjoined twins were born 4 months ago. Their parents made the agonizing decision to separate them. The boys didn't share any major organs, which made the risk of separation slightly lower, but this was still an extremely difficult procedure. Doctors at Great Ormond Street Hospital carried out the operation, 14 hours of surgery by some of the most expert medics in the world. A team of 20, including surgeons and anaesthetists, all working to give the little boys a future. The surgery was a success. The twins' parents and sisters, Malika, who's 4, and 2-year-old Iman, are delighted. They say the world is a better place with their little fighters in it. Hussein and Hassan are now in intensive care, sedated but stable. The road to recovery will be a long one. The next few days will be crucial.
So they had a surgery and came back to Cork and got admitted again in pediatric ward. And we had to do lots of splinting, positioning, and pressure care. And they had nearly more than 50 surgeries by this time. And different adaptation for car seat travel, and their bilateral coordination skills were delayed because of their closed proximity, and they had a limitation in upper limb shoulder movements, and later on they did very well, and they needed prosthetic limbs and sitting and positioning. And they are recovering very well, and this is after separation surgery. So each baby had one leg. So you might have seen Toy Story, many of you, and Woody his voice was given by Tom Hanks. So he gave a present to these twins.
Hello again. Now, Oscar-winning actor Tom Hanks has made a special Toy Story video for twin boys in Ireland who were born conjoined. Dubbed the Little Fighters, Hassan and Hussein Ben Haffaf have had their Toy Story figures with them through every operation.
To the soundtrack of You've Got a Friend in Me, Tom Hanks, the voice of Woody in the Toy Story movies, created this message for two brothers from Cork.
You've got a friend in me. You've got a friend in me.
Hassan and Hussein Ben Haffaf were born conjoined.
Hello.
But like Woody, have shown huge determination. The Little Fighters, as they've been called, have had over 50 operations. And for everyone, they've had their favourite Toy Story characters by their sides. Another friend, Micheál O'Hurley, who runs an ice cream parlour in Youghal, made contact with Tom Hanks.
We know the Ben Haffaf twins, and they're friends with our children. We know their needs, and it's a great story. We knew Tom Hanks, and we knew the boys loved Buzz Lightyear and Woody. So connecting them with Tom Hanks made a lot of sense.
Now 9, Hassan and Hussein have ongoing health concerns, but their mother Angie says they were overwhelmed with joy when they saw the video. The signed Woody dolls are expected to arrive this week, along with a note from their new friend, Tom Hanks.
You got a friend in me.
Now they have a prosthetic leg, and they walk without support, but sometimes they use wheelchair as well. They are 10 years old now, and they are saying thank you.
Hassan, and this is Hussein. Hassan and Hussein Ben Haffaf were born in London on December 2nd, 2009. 4 months later, they underwent 14 hours of surgery to separate them at Great Ormond Street Hospital for Children in London. The following month, along with their family, they were flown home to Cork by the Irish Air Corps. At that stage, they were already getting star treatment. Today, Hassan and Hussein are regular 10-year-olds with very different personalities. Although, like all children their age, they share a love of mischief.
Hassan, anyway, definitely the cheeky chappy, but Hussein then, definitely the quieter twin.
Cork-born paediatrician Dr. Edward Kiley led a surgical team of more than 20 doctors and nurses during the complex day-long surgery to separate the boys this day 10 years ago.
You say hello, Mr. Kiley.
This afternoon, the twins had a special message for him.
Hello, Mr. Kiley. Hope you're keeping well. Thank you for everything. Stay safe.
Over the past decade, Hassan and Hussein have undergone more than 50 surgeries and they've been hospitalized many times. But parents Azadine and Angie say the twins have always enriched their lives.
Wouldn't change a thing. You know, they do get ill and they do have very big surgeries. But I think it has made them the incredible little fighters that they are.
Plans for a party to thank the many people who have helped the Ben Haffaf twins and their family have had to be scaled back because of COVID-19 restrictions. Instead, they chose to broadcast their gratitude.
Thank you.
Pascal Sheehy.
Yeah, I meet, not meet them regularly, but they live close by where I live. I see them often in shopping centers. They are coming on well and still long way ahead. And they are overcoming all the difficulties and doing well. And they are adjusting their difficulty in their life. We all can learn from all these babies how they fight and from their difficulties and achieve things. We shouldn't complain for few little things. So we should aim for high, and we have to achieve all our ambitions. So this tough journey, 1,000 days and beyond, they are surviving and excelling in their life with difficulties, but they are doing well. So we discussed infant botulism, neonatal stroke with peripheral artery ischemia, congenital myopathy, congenital diaphragmatic hernia, osteogenesis imperfecta, conjoined twins. So all these conditions, we don't have any textbook description for occupational therapy role, but we have to adapt and be creative to give them occupational therapy assessment and intervention. I am privileged to help these kids and many other babies who are born in Cork and around Ireland, and helping budding humanity. I would like you to ask as many questions as you want. These are my few team members in the team. Neonatal nurses, pharmacist, clinical nurse manager, and specialist registrar. Thank you.
Thank you, sir. Yeah, like sir mentioned, we can have questions now.
I'm seeing lots of guesses. Very good.
So there is one question from Shivam.
Yeah. What are the we kind of use a Bailey assessment and a P-body developmental motor scale. These two are new, but other observations and play assessments are useful as well. Okay. Newborn behavioral scale and custom movement. Those also will be outcome measure.
I think someone's microphone is on. Can you switch it off? Any other questions?
Oh, sorry. Shivam has asked. He couldn't hear me. So in NICU, we use newborn behavioral assessment scale and Prestel movement scale, and we have Amiel Tyson scale for assessing tone and natural observations. And when they go home and come for outpatient department, when they come for follow-up, we use P-body developmental motor scale and Bailey assessments. Hope that's okay, Shivam.
So there is another question by someone. Were you able to find any relationship with parents' lifestyle related to these conditions?
Many no, it's nothing. Their lifestyle is not related to these conditions. No, it's it's not their fault, or it's a kind of many conditions are genetic, hereditary, and it's nothing to do with their lifestyle of these babies born. No relationship. Yeah.
Okay. Any more questions? Because we are kind of running out of time. Okay.
Shiva
Yeah.
asked how an OT participate in discharge with neonatologists. Yeah, like we like if the baby is very having complicated diagnosis and long-term stay, we do multidisciplinary meeting with all the team members, and we discuss how our OT program can help and guide the parents to go home in terms of car seat travel, and after going home, what kind of therapy program they need, and if they need any splinting needs, we give them splints, and that need to be reviewed every 6 to 8 weeks. So we bring those babies back to the clinic, and those things. And if the child is grown bigger, and if they need any housing adaptation, we have to refer on to them to community occupational therapy team. So they will be assessing the home, and later on in their life in school, they will have they will need a occupational therapist over there as well if they need. And these things will be discussed in discharge planning meeting in NACU before they go home.
Okay, thank you, sir. We can have one more question, I think. Splinting material that are specific to the babies.
Like if the baby is very fragile, we can have neoprene material, and it can be given to the very delicate babies. But other babies with, for example, congenital talipes equinovarus, that positional talipes, we can have a high temperature thermoplastic with foam padding, and splinting application should be restricted to shorter duration to avoid any pressure area.
Okay. Thank you, sir. I think we have reached the maximum limit of the question sessions. I'm sorry. The other questions, you can get the answers through email. So moving on to the feedback session, anyone would like to give feedback about the session that just happened?
Hi, sir. I'm Aditya from Ramachandra University. Doing my 4th year B.O.T. So your presentation was very informative. I really like that what you said at last. That most of these conditions you can't find the OT role or intervention process in the textbooks. That's what you said. So that's what our therapists or professors in our university, Ramachandra University, also promotes us. They always makes us and tells us to think like an OT. We have to think like an OT, which means we have to think uniquely for the patients. Also, we have to do a symptomatic approach for these patients, also these pediatric clients. And yeah, with all these images, the videos were very nice. Was pretty different from other presentations I have seen before. Thank you so much.
Okay, thank you.
Yeah.
Thank
Good
you,
afternoon.
Aditya. Okay.
Yes, ma'am.
Okay, Shah.
Proceed.
Okay. Yeah, you can.
Good afternoon, sir. I'm Shalini, doing fourth year B.O.T at Sri Ramachandra University. Thank you for presenting today. Your presentation was quite different from everyone else's, and I think that talking about practical experiences that you have had more than theory, I think that has created an interest towards your presentation, sir. And you have told, and you at last mentioned that it is very important to be creative, and I think that was the reason why you came up with this type of a presentation than being more theoretical. And sir, with that term that you mentioned, to be creative, I think that the first thing that I have to concentrate is finding the assessment areas for these types of rare conditions. I think that will be the primary need here. That is what I understood from your presentation, because only if we identify what are the like specific and unique assessment areas that we have to rectify for these types of rare conditions will be very important to differentiate it from other mainstream conditions that we practice OT on. So thank you for sharing your time and your valuable experience with us. Thank you, sir.
Thank you, Sean.
Yeah, moving on to the vote of thanks. I would really like to extend our gratitude on behalf of all of us towards you, Dr. Kannan, sir. When you started presenting itself, we could understand your personality as a very soft-spoken and very humble person. So thank you for using those videos, which was very innovative, and we could easily relate to the things that you said with the videos that we saw. And also, thank you for mentioning that it is the creativity of a therapist that is important in all these conditions, and also encouraging us to read upon those, and also for explaining these rare conditions that you have come across. I would once again like to thank on behalf of all the participants, and also from the Department of Occupational Therapy. Then I would like to thank our institution, Sri Ramachandra Institute of Higher Education and Research, for giving us this motivation and guidance in arranging this webinar on this current scenario. I would like to thank our HOD, Dr. Raghuram sir, and also our assistant professor, Sundareshan sir, for guiding us and giving us support in organizing this webinar. I would like to extend my gratitude towards all the participants who patiently waited till it started, and for giving feedback in the chat session. Thank you everyone who are especially participating from outside India, from their own time zones. Thank you all, the alumni and all the students who are participating. Last but not the least, our Ramachandra students. Thank you guys for participating. Once again, I conclude by saying thanks to all of you.
Thank you, sir. Thank you for your wonderful presentation, sir. Thank you so much. Thank you all.
Thank you, Raghu, Rima, and all the participants. And Dhanyavad. Jai Hind.
Jai Hind.
Okay, see you all in the next webinars.
Yes, sir.
Sir, I will get back to you over the phone, sir.